জনরব মিডিয়া, জনতার কথা বলে।
নমস্কার, আপনারা দেখছেন জনরব মিডিয়া। বিএম বিড়লা 31 বছর পূর্তি উৎসব উপলক্ষে হৃদয়ের সমস্যা সম্পর্কে বলছিলেন ডাক্তার। চলুন আমরা পায়ে পায়ে বিএম বিড়লা হার্ট রিসার্চ সেন্টারে প্রবেশ করি। সেখানে 31তম অ্যানিভার্সারি উৎসব কিভাবে পালন হলো তার একটা নিদর্শন তুলে ধরার চেষ্টা করব। আপনারা দেখছেন জনরব মিডিয়া। এখানে হৃদয়ে আঘাত লাগলে ডাক্তারবাবুরা আধুনিক প্রযুক্তিতে, এমনকি করোনা কালেও ডাক্তারবাবুরা রুগীদেরকে হৃদয়কে ঠিক রেখেছেন। তারই আলোচনাকালে ডাক্তারবাবুরা তাদের অভিজ্ঞতার কথা, 31 বছরের অভিজ্ঞতার কথা শেয়ার করলেন।
We also spoke about and discussed in brief around the affordability and accessibility of healthcare to all sections of the society. As an organization, as a vision of the promoter family, this is something which we are very, very careful about and which we are very conscious about. So our aim, while to invest on technology, to get the best equipment in place, to make sure every person gets a treatment in terms of cardiac science, probably which is comparable to anywhere else in the world, is besides all of this is also to ensure that treatment is accessible to all society sections of the society. Nobody remains bereft of the treatment we provide. We will be investing majorly on technology. As all of you know, it's going to be an era of digital, not only in marketing and not only in a particular field, but probably every aspect of our life is going to be touched by digital in the coming years. So as an organization, there will be a lot of focus on that. As an organization, there will be a continuous focus on upgrading our infrastructure and medical equipment. As an organization, there will be a constant focus on upgrading our clinical skills, our nursing skills, and the support services we provide. So it's not only about just treating the patient clinically. It is a holistic experience of a patient who comes and spends 7-8 days with us and walks out of this door happily, treated well, having got value for money which was spent on his treatment, on his or her treatment. So the hospital and belonging to all sections of the society. That's the key. And having got treatment comparable to the best in the world, which I'm so proud of as far as our clinical team, our team of doctors is concerned, which is already in place.
Coming in science. I would request Dr. Mishra also. Dr. Mishra has done a lot of pioneering work in cardiology, like
the cardiac world, or are going to come. I think about 3 different kind of subspeciality of cardiology. Cardiac intervention or angioplasty, as common people call it. Next is cardiac devices between pacemakers and ICDs and CRT. And third is structural heart disease. So talking about structural heart disease first, the most important innovation that has come into the cardiology world is something called TAVI, or transcatheter aortic valve replacement. Okay, this has been around for past couple of years and slowly it's becoming increasingly popular in our country. So traditionally, people who have a valve disease would get it treated by surgeons. So Dr. Daga, we would send the patient to Dr. Daga and he would open the chest and replace the valves. Okay, but nowadays, now we have a technology whereby we don't need to send the patient to a surgeon or to send all the patient to a surgeon for open heart surgery, but we can replace the valves from the leg itself. So just like we do angioplasty rather than bypass surgery for blockages, we can replace the valve through the leg, through a small hole in the leg, rather than cutting open the chest. Since it's a newer technology, it's a more expensive technology, it's not something that we do in every patient with the valve disease. But high risk patient or moderately high risk patient who are deemed too risky to have surgery. Actually sitting right behind us, and we'll talk about it in a bit. But this is a lady who came to us with a valve that was not opening very well, and she has a lot of other comorbidities for which she was deemed too high risk for an open heart valve surgery. So we replaced the valve from the leg, and TAVI is increasingly, going to be more and more popular, and will probably be doing more and more TAVI cases in times to come. So that is we are putting in lots of pacemakers, ICDs, CRTs, and they are always newer models, newer devices with modern features coming up. But one new technology that has come this year, and we have done a pacemaker a few months back, which is like a Bluetooth technology. So you put a device in a patient and the patient goes home. And in my case, this patient was from Chhattisgarh. So now, once the patient goes away to their home, it's sometimes very difficult for us to monitor these devices. But with newer technologies, we can do so because these devices can get connected to a patient's mobile phone via Bluetooth technology. And patients can then transmit that data regarding their pacemaker, their devices to us.
It's been a long journey. I've been with BL Birla right from the inception basically, and it's been a very, very interesting journey. I have had the opportunity, being lucky enough to see all the major advances in cardiology, what we have seen over the last 2-3 decades. And fortunately, we have been able to introduce all those technologies over all these years to the eastern part of the country. I mean, I remember the first road operation I did for the Eastern India was back in 1996. Before that, we did first arterial revascularization, which was done in this hospital as well. The first radial angioplasty in the whole country was done at this vascular stenting. By doing that, we did that first in Eastern India here as well. So there are so many firsts we did here. So we have been lucky to be part of this journey and have the opportunity to introduce all these technologies for benefit of patients in Eastern India.
That patient, he is only 22-year-old gentleman at that time when he had the heart attack. He came with severe chest pain, and he was telling he came from Ramakrishna Mission Hospital where very good treatment was afforded to him, but at that time there was no cath lab. So they couldn't go for angiography and angioplasty. Now they can go for it, but he received very, very good medical treatment. But that was not sufficient. The patient was getting severe chest pain, and his parents who were in 50s, they were crying, and the boy was also crying because of severe chest pain. So we took immediately to our cath lab within 45 minutes, and we could save his heart. And he's working 14 to 16 hours. Now the intention of this question, I think, is what are the risk factors and what is the cause of this premature disease in our country. So number one is smoking, but that chap was not smoking also. So in a 40 to 50% patients in heart attack in younger group, we don't always get some risk factor. But if we investigate properly, sometimes we do get, like hypothyroidism. The patient had hypothyroid, the patient was hypothyroid. He was a vegetarian, he was a non-smoker. Now these are the risk factors, that is smoking severely or even more than 10 sticks, not necessarily 10 sticks, even 4 or 5 is also dangerous. So smoking, high blood pressure, high blood sugar, high blood cholesterol, high triglycerides. Also there is an element, little lipoprotein A, which is atherogenic. Not to all the people. We don't know the answer. We don't know the answer in medicine of all the questions. So the people are not getting employment. He is highly qualified but not getting the proper employment. Or even if he gets, it's underemployment. If a MPhil does a clerkship job in a college, he is scheduled for a professorship or assistant or lecturership. But if he goes for a clerical job, it's underemployment. So especially in this pandemic duration, there are lots of unemployment in our country. And also I want to talk about one facet. I think we should mention about that. We are telling about the high-tech technology, but we have made it available to all sections of the society.
Are usually very high risk. Already must have had angioplasties, have had multiple blockages, must have had heart attacks with heart going down, with some mechanical problem to the heart, like some valve leak or a hole in the heart, or a whole of the pipe getting ruptured or getting torn or getting enlarged. So most of the surgeries which normally come to us is usually a complex cardiac surgery. Patients' heart functions are down to 20%, 25%, 30%. So all these needs a specialized holistic approach by doing surgery, extreme good critical care with newer interventions, newer methodology to diagnose the problems and treating them. Even for pediatric population, we get a lot of complex surgeries. A kid comes to us with multiple defects, 3, 4, 5 defects together. It's very difficult to operate on a kid with 1 month age, 2 months age, with all these problems, with a prolonged ICU stay, prolonged operation time, with a lot of reaction to the heart-lung machine that we have. So complex cardiac surgery has become a part and parcel of our day-to-day life. We do them day in, day out, and it will continue to increase. The more the interventions happening, more complex surgeries, because only people who cannot have cardiological procedures or are too high risk or who do not have any other choice, they only would come from cardiac surgery, ICU. That's how it is.
এতক্ষণ শুনছিলেন হৃদয়ের সমস্যা ও হৃদয়ের উন্নতির কথা। আমাদের সময় থাকতে হৃদয়কে ডাক্তারের কাছে নিয়ে যেতে হবে খুশির জীবন কাটানোর জন্য। আপনারা দেখছেন জনরব মিডিয়া। আবার আসছি অন্য খবর নিয়ে, হৃদয়কে নিয়ে